HealthBreak is brought to you by South Central Regional Medical Center in Laurel.
May is Better Speech and Hearing Month and a good time to have your hearing checked, as the prevalence of hearing loss in the United States has doubled over the last 30 years. Audiologist Sharon Crumpton says a hearing test can determine if you have one of many medically treatable forms of hearing loss.
You can have hearing loss called a conductive hearing loss from having wax in the ear canals, and the ear, nose, and throat doctors, they can clean the wax out and the hearing's restored. It's also ear infections, middle ear infections, fluid behind the eardrum. Usually that can be treated with antibiotics. And then for nerve damage, which is the most common form of hearing loss over the age of 65, hearing aids are a very viable and beneficial option.
Also, it's very important to have your hearing test performed by a licensed audiologist. Audiologist Jessica Smith explains why.
In the state of Mississippi, you don't have to be an audiologist to dispense hearing aids. I would be leery of anyone that comes to your house that doesn't have a physical office.
It's also beneficial to see an audiologist who is in your community.
Hearing aids are not like glasses. It's not something you just put on and then you're good for several years. Hearing aids take a lot of adjusting. We want them to come back twice a year at least, just for servicing and cleaning and keeping an eye on the hearing aids.
Studies show that people typically suffer from hearing loss for a decade before they seek help.
And once they finally take that step and try the hearing aids out, it makes a huge difference in their quality of life, and it makes a difference for the people around them.
To register for the free hearing screening on Wednesday, May 21st at South Central Place in Laurel, call 601-399-0501. For HealthBreak, I'm Catherine Farah.
HealthBreak was brought to you by South Central Regional Medical Center in Laurel.